Well, good morning and welcome to the South Carolina Hospital Association Zero Harm webinar. Our Zero Harm initiative recognizes the high reliability efforts that South Carolina hospitals are making every day to eliminate harm from their facilities. In 2023, we celebrated 69 member hospitals winning a total of 365 awards. This equates to 2,300 fewer patient days in the hospital and savings of more than $7 million in healthcare costs for South Carolina hospitals in 2022. For a full list of our 2023 award winners, please visit www.zeroharmsc.org. And we welcome you all today for attending. And as a reminder, we will be providing our contact information at the conclusion of today's webinar if you have any questions about the Zero Harm program and how to apply this year. So just to briefly go over our agenda for today, welcome. As I mentioned earlier, I will review a little bit about the history of our Zero Harm program. We will do a comprehensive review of our 2024 Zero Harm Awards program. And then I will do a live demo of our award application portal, and I will kind of walk you through that process. We just want to quickly thank our presenting sponsor, Blue Cross Blue Shield, for their support of our program, and also our supporting partners that you can see here on the screen. We want to give a special thank you for their support. So last year, South Carolina Hospital Association, as many of you know, celebrated 10 years of achieving zero harm, and we're looking ahead to the next 10 years. Over the last 10 years, member hospitals have continually united on statewide efforts to create a culture of high reliability and reduce harm in our facilities by implementing robust, evidence-based practices that are making a positive impact on patients and the safety and quality of care. So I encourage you to just take a quick look at this journey of our Zero Harm program. This is also available to see on our website. And you can see, the progress that we've made with our program, the many partners that we've had that we truly could not have enhanced this program and continued the success of this program without all these partners that are listed on our timeline. So now I'm going to move into our review of our different awards that we will be awarding this year for the Zero Harm program. Our first award is the South Carolina Hospital Association Drive to Leadership Award. The Leadership Award recognizes and celebrates leaders who strive for zero harm at every level of their organization. Award winners have demonstrated a track record of commitment to creating sustainable cultures of safety throughout their healthcare system. Candidates are nominated locally, and nominations are reviewed and scored by outside reviewers. These awards are rooted in SCHA's Zero Harm High Reliability Blueprint, based on American College of Healthcare Executives, and the IHI Lucian Leaps Institute's Leading a Culture of Safety, a Blueprint for Success. These awards are based on the leadership benchmarks established in this white paper and essential on the journey to high reliability, but are often at least one step removed from clinical practice. All member hospitals are encouraged and eligible to nominate a leader within their organization that exemplifies these pillars of high reliability. So in your nomination for this award, you will focus on a vision for safety, trust and respect, board engagement, leadership development, just culture, and behavioral expectations. Next, we will review about our Certified Zero Harm Clinical Awards. The Certified Zero Harm Clinical Awards are the cornerstone of our Zero Harm program, and we recognize hospitals that prevent all hospital-acquired infections of a specific nature over an extended period of time. SCHA revamped these awards in 2021, and we pivoted from the historical timeframes, and we now validate 12-month periods going forward. The data for these awards is independently certified by the South Carolina Department of Public Health in a unique third-party verification process using NHSN data. And awards can be earned by having zero harm in any of these clinical areas for a 12-month period, starting January 1st, 2023, and ending December 31st, 2023. So the 8 award categories for this year for clinical awards are pressure injuries, central line associated bloodstream infections, or CLABSI, MRSA, C. diff, and we have 4 surgical site infection categories. The first is hip replacement, colon surgery, abdominal hysterectomy, and finally knee replacement. So those are the different award categories for this year. For the pressure injury award, that is the only one that is a little bit unique. And for pressure injuries, the measure assesses the proportion of inpatient admissions who suffer the harm of pressure ulcer stages 1 through 4. The measure defines a pressure injury as not present on arrival to the hospital, and we use RFA claims data to analyze and determine eligibility for this award. No additional application is necessary for the pressure injury award. If you apply for one of the other clinical awards, you are automatically applying for the pressure injury award as well. And awards will be earned for a 50% or greater reduction in hospital-acquired pressure injuries from 2022 to 2023, or no hospital-acquired pressure injuries in 2023. This year, I'll go into a little more detail. But the only change for this year regarding our clinical awards is our CLABSI units. Previously, the past few years, we have allowed for up to 12 units, our CLABSI units. This year, hospitals will be able to either choose hospital-wide or pick 3 CLABSI units. So please note this change from last year. We had to make this change this year in order to manage the increase in individual CLABSI award applications over the last few years, and to better streamline our validation process with the South Carolina Department of Public Health. Last year, we also implemented, regarding our CLABSI award applications, we now require a minimum of 50 central line days in any NHSN designated unit. So the minimum will be in effect again this year for CLABSI applications. So at this time, I would like to turn it over to some of our speakers. We have invited some of our experts regarding our priority awards this year. Last year, we kicked off and introduced a priority award category. And as our program continues to expand and evolve, we decided to establish the Zero Harm Priority Awards last year. And this recognizes members who are having success on major issues related to harm more broadly, from eliminating health disparities to ensuring a healthy workforce. The specific awards will change over time as the more pressing issues change and evolve over time, but the larger goal will remain the same of our priority awards, and that is supporting hospitals in their commitment to process improvement and high reliability in the care of their communities. So for this year, for 2024, our priority awards will again include the Drive to Zero Disparities Award, the Drive to Zero Workplace Violence Award, and the Drive to Zero Suicide Award. So the first award, our Drive to Zero Suicide Award, I'd like to introduce Jessica Barnes with the South Carolina Department of Mental Health. She is a program manager there with the Office of Suicide Prevention, and they are one of our great partners. They've really helped us to develop these metrics the last few years. And so I've invited Jessica today to kind of review those metrics and go over what will be required in order to win that award today. So Jessica, I'll turn it over to you.
Thank you. So I work with the Office of Suicide Prevention with the Department of Mental Health. And some of the things that we're going to be looking for would be within these 5 categories. So your training. Training is specifically around suicide prevention training that you are providing to your staff. And this is staff that could be in multiple departments, emergency rooms. And we give some examples of evidence-based trainings that would meet these standards. Talk Saves Lives, Safe Side Prevention, a Zero Suicide Academy, CALM training. You can also go online to the Department of Mental Health, and my office is the Office of Suicide Prevention. I'll put the link in the chat. And we list other suicide prevention trainings as well on there that we tend to offer across our state. And you can always try to bring some of those trainings into your hospital as well. And these are to help people identify the risk factors and warning signs to people who are at risk and help connect those people to somebody that can help for more long term and will help them keep that person safe until they can get connected to care. So this is important. If you have applied before and received the award in the past, you will be required to show some type or to validate that you did have an improvement in this training. And if you did not, justify why. Was there a decrease in staff? These kind of things we will look into after you acknowledge that or attest that you did do an increase in trainings. And that will be the same for all the policies, safety planning, screening, and the other categories as well, as that you would attest that to some degree there was an improvement or a review on what was happened if you had received the award before. If you had not received the award before, then you were going to be showing how you were addressing these things. So for policies, we are looking into what kind of policies do you have that kind of address and support suicide prevention efforts. The examples of policies that are in here, care and contacts, are if somebody is discharged or transitioning even through care within your hospital, is there a way that you send a reminder to the person of just saying, hey, I hope you're doing well and we're thinking about you? These are different than appointment reminders. It is just showing a person that we care, and that can really help with support, especially for somebody who is having thoughts of killing themselves. Do you have postvention policies? If somebody had died by suicide or had an attempt at suicide, are there things that you can do to help, not just for your patients, but maybe also for your staff? So also taking care of staff. Are there, if there's discharge, is there policies around how you discharge a patient and maybe so that can provide them crisis resources? So those are some of the things that we might be looking for. With safety planning, we're seeing for those people who are at risk of suicide, are you doing a safety plan with the person? The one that's listed there is an evidence-based safety plan that we do highly recommend. This is the Stanley Brown Safety Plan. You can get approval from Stanley Brown to kind of have these things also embedded in your EHR. So it's part of your EHR tools. And that way we can know that we are doing a safety plan for our patients that is evidence-based. With the screening, the same thing with the Columbia Suicide Severity Rating Scale, the PHQ-9 depression scale, iCare. These are evidence-based screening tools that we will be looking for because it's important to screen our patients. All patients coming in, when we are thinking about suicide, it's rarely just one thing that is leading to a person who is having thoughts of killing themselves. So by coming to a hospital, there's probably a multitude of stress that's already there. So it is important to screen our patients and make sure that there's not something else also going on with their mental health while they're also trying to get treatment for their physical health. Then also information about follow-up care. How are you transitioning your patients? What is showing that it's best practices in care transitions? This can kind of loop back in with policies. Do you have policies around how you safely care transition somebody? And then again, this is both with discharge or if the person is transitioning in care throughout your hospital system as well. So those are some of the things that we are looking for. And again, I'll put my website in the chat for the Department of Mental Health that will have some resources. It can also have some things that there's training that we can additionally suggest that's not just listed on here. And we also have printable flyers that maybe you can include, or cards and things like that you can put around your hospital system and or attach to patients' discharge paperwork. Is there anything else that you need, ma'am?
Great. Thank you so much.
Okay.
I think that was extremely helpful. And at the end of the presentation, as I mentioned, I will have Jessica's contact information as well as the other speakers that are talking today about the different priority award categories. So if you have any specific questions about any of these awards, they will be more than happy to answer those questions. And of course, I can help as well. So thank you, Jessica, for a great review. And
you're welcome. And even if it's down to, we have this training and you want to show us a video of the training that you do and see if it meets, I'll be happy to review and discuss that with y'all.
Great. Well, thank you so much. And we thank you so much for your partnership and look forward to working with you all again this year. Thank you. So now I'm going to move on to our Zero Workplace Violence Award, and I'd like to introduce Beth Morgan. She is our Director of Clinical Affairs and Workforce at the South Carolina Hospital Association, and she has been really helping us to develop the metrics for this award, and she is going to review the requirements for this year for the Zero Workplace Violence Award.
Thank you, Nan. Good morning, everybody. I recognize a lot of names on here, so good morning. First, let me shout out to my colleagues at Anthem Risk, who have been our partner in this work and have been a pleasure to work with. So we are kind of on year 2 of this Workplace Violence Collaborative and the Drive to Zero Workplace Violence Award. And we changed a little bit from last year, but it's not not too different here. So if you look at these categories, Nan, and I'm on 2 different slides here, so she's going to kind of go back and forth for me. We've got kind of 5 different categories. You'll see collaboration, written program, training. Hit that next slide for me. Response and patient evaluation. And so each one of those has, I believe, 3 different things in there, and you have to attest to all of the components of each category. If you did not win an award last year, which was our first year, if you did not win an award in 2023, you need to attest to 4 of the 5 categories. If you did win an award last year, and many of you did, congratulations. If you did win an award last year, then we're kind of raising the bar on you a little bit. Just as Jessica said, each year we need to kind of show a little bit of an improvement. And so if you did win an award last year, you've got to now attest to all 5 of these categories. The big change is this first one here under collaboration. So participation in the Workplace Violence Collaborative, as well as submitting incident data. As you guys are reviewing this information, if you have any questions whatsoever about whether your hospital is participating or not, whether you'd like to join, which we'd love to have you, reach out to me. Dan's going to provide my information. Please reach out, and I'm happy to talk through stuff with you. If you're not quite sure if one of the things that you do at your hospital sort of meets the criteria, then just reach out and we'll talk through it. And then Nan, if you'll hit that second slide for me. I'm going to show you too another additional thing. So we added this thing on the bottom. You see it says best practices. We're kind of testing this bad boy out this year. And so we want to, you'll attest to each 5 of the categories, 4 or 5. And then we also want you to include 2 what we call best practices. And this is anything sort of innovative that you're thinking that you guys have done at your hospital. If you've designed a different training exercise, if you've partnered with some folks in the community to do some things, if you have a different way that you disseminate information to your staff members. These are all things that count. If you're not sure if it's a best practice, again, reach out. We'll talk through it with you. But there's a lot of cool stuff going on in the state, and we want to highlight that. We want to share it with everybody. We want to give you kudos for all the great work that you're doing. So those are the additional things on there. Really proud of this program and everybody that's been a part of it. If you look across the country and you see any states that are doing this kind of as a statewide initiative to focus on workplace violence, it's typically mandated. And so we are so proud in South Carolina that this is a voluntary effort. And as of today, we're almost every acute care hospital in our state's participating. So very, very excited to hear what you guys are doing within your hospitals, and want you guys to get this award so you can show your staff, show your community that you are doing everything possible to keep them safe. And happy to answer questions via email when Nan gives you that information. Don't hesitate to reach out. That's it for me, Nan.
Thank you so much. And a couple people commented about some volume issues hearing me, so I do apologize about that. And we will try to adjust that on our recording. If you all are having any issues hearing me, my apologies about that. We're going to move on to the Zero Harm, Zero Disparities Award. So I'd like to now invite Annika Moonen, who also works at SCHA and has been extremely instrumental in helping us over the last couple of years to help us to develop the framework and the metrics for our Zero Harm, Zero Disparities Award. So at this time, I'm going to turn this over to Annika Moonen and allow her to talk a little bit of our journey in establishing this award and the requirements this year for the award.
Thanks, Nan. Good morning, everybody. Thanks for joining today. I am pleased to introduce the Drive to Zero Disparities Award. We had roughly 12 hospitals who won the award last year, and we hope there'll be more this year. I'd like to start off with providing some background on the purpose and significance of this recognition. Since COVID, we had an active Health Equity Board Council, which was appointed by the SCHA Board of Trustees. And there is diverse representation from a lot of hospitals and health systems and statewide partners like the Department of Health and the Alliance for Healthier South Carolina. We continue to meet monthly, and we often discuss ways to advance health equity in our hospitals. And the board really wanted the team to pull together an award since it's one of SCHA's focus area of interest. In addition, as everyone knows, CMS included some health equity measures in their federal fiscal year 2023 final rule for the Medicare Inpatient Prospective Payment System, otherwise known to you as IPPS. That's in alignment with the CMS initiative and in response to the board's encouragement, the Drive to Zero Disparities Award was created. This award is given in partnership with SCHA and the Alliance for a Healthier South Carolina. So keep in mind, we want to celebrate hospitals that have been really in the forefront of advancing health equity. So the slide that you see here, hospitals' commitment to health equity, hospitals must attest to the completion and implementation of all 5 out of 5 domains during the entire timeframe of July 1st, 2023 through June 30th, 2024. And last year, I believe it was 4 out of 5. This year will be 5 out of 5 domains. Part 1, it's more of structural measures using, if you can see, a suite of equity-focused organizational competencies. So includes all the domains for this measure you'll see on the slide. Number 1, equity is a strategic priority. We want a hospital that has a strategic plan for healthcare disparities that includes goals, resources, and action steps. Domain number 2, data collection. We want to make sure the hospital collects the data reliably for demographics and social determinants of health. Part 3, domain 3, data analysis. Want to make sure that the hospital stratifies the data to identify equity gaps and are included on performance dashboards. Domain 4 is quality improvement. Here we want to make sure the hospital participates in quality improvement activities, focus on reducing health disparities. And then domain 5 is leadership engagement. We want to make sure that the hospital leaders and board members review the strategic plan and key performance indicators, KPIs for equity and social factors. Again, just a review that hospitals must complete 5 out of 5 domains to receive credit for part 1. Next slide, Anan. Part 2 is looking at the screening for social drivers of health measures. And the measures, we want to look at what the hospitals have implemented social determinants of health screenings for all inpatients 18 years or older at the time of admission. So the screenings, as you can see, include food insecurity, housing instability, transportation, utility, and interpersonal safety. And just a little bit of history, whether you know or not, SCHA had an active social determinants of health collaborative for several years. It sunsetted last year, but one of the goals of this collaborative was to make sure that hospitals had appropriate tools, whether it lived in the EMR or a certain vendor tool, to screen patients for social needs. So for part 2 of this award, hospitals must attest that they screen for 5 out of 5 health-related social needs for all inpatients. And there are some exclusions noted on the application, but this is for the entire time frame of July 1st, 2023 through June 30th of 2024. If a hospital completes both sections 1 and 2 and submit their information in the portal, then they will receive the Drive to Zero Disparities Award. For this particular award, there is a validation committee that will ask a very small percentage of hospitals applying for this award to provide additional documentation for award validation. And that wraps up my presentation. Nan, again, feel free to contact me or Nan if you have any further questions. And thanks for your engagement, and I look forward to seeing your application. Thank you.
Thank you, Annika, and thank you all for your review of our priority awards this year. I'm going to just talk a little bit about a few changes and new for this year, and then I'm going to provide a quick demo of how you will navigate the online application. So the application portal dates will be August 14th through September 13th. We did push those dates back a little bit, so we would kind of be out of that summer period and allow hospitals a little more time to be able to gather everything for the application. Another change, as mentioned earlier, with our clinical awards is, again, this year we are requiring 50 or more central line days per unit. And we are allowing hospitals to apply for CLABSI award either hospital-wide or up to 3 NHSN designated units. We talked about our priority awards. As you can see, there are a few changes this year. There are a few more metrics that are required this year, with those being in the second and third years of those awards. And also, we will be celebrating again our hospitals at our second annual Better State of Health Summit. And just want to remind you all to mark your calendars. We'll be sending out more information about that celebration, but that will be the time that we will recognize our member hospitals for their Zero Harm Awards this year. And that will be held December 10th through 11th. As mentioned, the portal dates will be August 14th through September 13th. We will be sending out through our communication channels at SCHA the portal link when the portal opens, and we will make sure that you know of that. We will also have the link available and live on August 14th on our website. Multiple users are allowed to apply from each facility. Some hospitals will choose to apply for all of the awards with one representative, but you certainly can have multiple representatives with multiple areas of the awards. If you would like to have more than one application, you can certainly submit those depending on what the award might be. You are able to save and create an account. So if you go into the application and you need to gather more information, for example, with the Workplace Balance Award, if you need more time to gather those best practices, you can go into the application, save it, create a password, and come back to it. So at this time, I'm going to do a quick demonstration of the online application. I'm just gonna share my screen and show you all kind of what the application will look like. Okay, so you can see here, this is what the first page will look like. It will have a link to our Zero Harm website. We will also have a link to this webinar that you can use as an additional resource. And we will also have the link to the frequently asked questions. So we want to have all these resources available for you on the main page. And this also has the save and return option that I mentioned earlier. So you can do a login and create a password. So this is kind of our main page, and then here you'll hit next. And here you will enter in your information. You will enter your name, title. Your hospital system will be a drop-down box. If there's any issues with that, please reach out immediately and let us know. We've listed all the hospitals here. And then you will provide a good contact email and then a phone number. And then this box will allow you to pick, you can select all 5 awards. You can select just clinical awards. Some hospitals may just want to do the leadership award. So this gives you the option to pick which awards you would like to apply for. So I'm going to choose all of them so I can show you how to apply for each one. So first is the leadership award, and this is a written application. And so you will just submit here. You put your hospital name, you can put an apartment here. And then here you will just enter in your information will feed over to the nominated by, but you can certainly change that if you'd like to. And then you will submit, you will choose a file and upload it here. And then for our clinical awards, you will do the same thing with the drop-down box. And we have all the information here, but you can certainly go to our website and it has the same information as a resource. And we do have the NHSN manual that you can view as well as an additional resource. But you will simply pick your hospital and you will pick which awards that you would like to apply for. All of the awards are hospital-wide with the exception of CLABSI. And with CLABSI, you will either pick hospital-wide or you can pick up to 3 CLABSI units. So here you will do the NHSN defined name. That's how you enter it into NHSN. And then if you have a different name that you've listed at the hospital, that's how we will list it on the awards listing. So you can certainly do that here. And then pressure injury award, as we mentioned earlier, that is something that is automatically applied for if you apply for one of the other clinical awards. For the Zero Suicide Award, you will also choose the drop-down box and you will pick, there are 5 categories required this year. This year, one of the differences, if you are a previous winner, you will attest that you have done these things. If you are a new applicant and have not won the award in the past, South Carolina Department of Mental Health will contact you directly to provide further documentation of these metrics. So we will click all of these, and that's all you have to do for that as far as the testing. We have a link to the metrics guide if you want to look at those in further detail. And then the Workplace Balance Award also has a drop-down menu. You will pick your hospital system. And as Beth mentioned, if you did not win the award in 2023, you are required to attest to at least 4 categories plus the 2 best practices. If you won the award last year, you will attest to all 5 categories and provide 2 best practices. So you simply will click here to attest. We even have a calculation where you can just double check before you submit. And then you will submit 2 best practices and provide some information about what you've implemented in your facility to reduce workplace violence. And the last award is our Zero Harm, Zero Disparities Award. And again, you will pick your hospital system with our drop-down box. And this year for Domain 1, or Part 1, all 5 domains are required and it is attestation. So you will attest that you have implemented all 5 of these domains in your facility. And we have a calculation here. And then for Part 2, you will attest that you are screening for 5 out of 5 of these social drivers of health. And we have a calculation here. So that is a quick review of our application. As I mentioned earlier, we'll provide our contact information, and that way you can get in touch with us if you have any questions or need, anything else. We are happy to answer any questions you might have. So I apologize. I'm going to go right to the end here and want to include our contact information. So for our presenters, here is Jessica's information, Beth, as well as Annika. If you have any questions specifically about the priority awards, they would be happy to answer any questions you might have. And my information is here, and I encourage you to please call or email, reach out to me and let me know if you have any questions. We thank you all for joining us today, and a special thank you to our priority award presenters. Please feel free to reach out to them again if you have any questions, and I also encourage you to reach out to me as well. We hope that you will consider applying for Zero Harm Awards this year, especially if your hospital has not applied in the past. And as always, we're here to assist you. This webinar recording will be sent to all attendees and will be provided on both the Zero Harm application and on our website. We will email you the presenter information as well. So be sure to visit zeroharmsc.org for the most up-to-date information about the Zero Harm program. We also have a Zero Harm email distribution list. If you are not already on that list, please reach out to me via this email or phone number and let me know, and I'd be happy to add you to that list. We will be sending out notices a week prior to the portal opening, a day before, and the day of as a reminder. So thank you all for attending. We did finish up a few minutes early, so I will stop the recording. And if anybody wants to stay on and ask any specific questions, I'm happy to answer those questions. But thank you all for joining us today, and we look forward to working with you all this year. Thank you so much for attending.